And that's the second point that we also realize, and we're reminded all the time by NGOs, I have to say, including Autism Europe, that everything we have to do has to be in accordance with the UN conventions, and particularly the Convention on the Rights of Persons with Disabilities and the rights of children, the Children's Convention. So the challenge for us is to develop activities which create this link between health and development, whereas we have to stay within this overall human rights perspective based on the various conventions. This is what we try to achieve. And again, this is a challenge because everyone is pushing us to achieve large amounts of massive change, and we're aware that the scope which we can operate on our own is limited, which is going to be one of my conclusions, that the partnership with often far larger NGOs, such as Autism Europe, is so important. But the first objective of what we try to do is simply awareness raising, bringing senior policymakers together at our conference in Romania, Bucharest, on the 26th of November, bringing it together, putting the facts to them, making them sign a declaration, and take a message home that they have to look at what they are providing. Identify the challenges, and I will say a bit more about that, that people are even aware of actually what needs addressing. Create the opportunities for particularly NGOs. Can we create space for NGOs to fill and move forward with your activities? Can we create more perceptive ministries of health who will open the door to you and then work with NGOs and obviously with WHO to create change? The partnerships is the same, or the dissemination of best practice again. I mean, what do we know from one country to the other? Can we create opportunities at a conference to create networks? Can Bulgaria learn from Romania? Can Romania learn from France? France from, etc., etc. And finally, and that's the key one, can we sustain change? Too often, and I'm an expert on mental health, really not intellectual disabilities, there are these sharp, temporary initiatives funded by external donors, lasting for 3 to 5 years and collapsing when donor money is disappearing. Again, probably a very similar picture to you. Would we be able to develop alternative community services for these children which would last? And that is really a very hard one. Now, before I go on and say a bit more about the declaration, let me put to you some of the challenges we're facing in Europe. Some of the bits which is actually we're aware of, which are particularly difficult. And, sorry? Oh, probably speaking, sorry. The first of all is the neglect and abuse and discrimination. Examples in institutions in the community. And I've already said it before, but I want to put it here again, because I think the first right of everyone, universal right, has to be at least security against abuse and neglect. The second challenge we're facing in so many of these countries, based on my previous, not my previous, but overhead with figures a bit more ago, is how reliant we are on poor living conditions, the low quality of care, and the lack of educational opportunities for children in many of our member states. And this is again recognized by governments, but they find it hard to act. And where people have the institutionalization strategies, they're either not good or they cannot be implemented. So we have a massive strategic challenge here, and the challenge of linking the strategies that sometimes is available to the implementation on the ground. And that is linked to the next point, the lack of community services. The number of children with intellectual disability in the community is increasing, partly as a consequence of the institutionalization strategies, but there are quite a few countries that have not compensated by developing community support services. And that can lead, paradoxically, to children living where we want them to live, with families who are in the community, but actually being terribly badly off, and families also suffering a lot as a consequence. Second challenge is, and this is more related to the WHO, the underserving of the health needs of children with intellectual disabilities. And this is, of course, core of our agenda. What we have perceived is that there are often 3 levels of neglect, one adding to each other. It's, first of all, that basically there is no health service for these children. Secondly, is that if children do get access to these health services, their problems aren't recognized. And the last one is if the problems are recognized, they are attributed as a consequence of their intellectual disability or autism, rather than as an independent health problem. The diagnostic overshadowing an important concept. And there again, one needs to address the challenge being, on the one hand, intellectual disability being a responsibility of mainstream services, but on the other hand, the opportunity to provide specialist support to GPs and to nurses to ask advice and receive care whenever that's required. And that, of course, always slips off the tongue nicely. It sounds easy when one talks about this, but to create these kind of services, create the change in attitudes from the practitioners is a massive challenge, where already quite a few NGOs are active, but it's still a long way to go. And the third challenge I want to raise with you is an intriguing one, and that is that we know so little. Someone recently asked me the question of what I think is the best way to achieve power. And I answered, well, it's knowledge and information. It was actually the wrong answer, because the right answer was access to the boss, access to the leader, according to Machiavelli. But the reason I said that power is linked to knowledge and information, that unless you actually know how many children there are, what their problems are, what intervention they require, on what scale, what do we have to say, even if we do have access. And this is a wonderful quotation from our background paper, that it's essential that we understand that this neglect, this unawareness of figures, is indicative of the failure to recognize and to respect the needs of this group. That as a consequence of this ignorance, there's this hidden population who are unknown to the official system and will not get care. So knowing figures, doing epidemiological studies is very, very crucial. And these hidden populations mean that governments and also local health services, local social services, are an opportunity that they do not offer services, sometimes simply because they do not know. So we now, as WHO Europe, are developing this initiative on health and health for children and young people with intellectual disabilities and their carers. And we have created a partnership with a large number of NGOs. We are also cooperating with UNICEF, and we hope with the European Commission and the Council of Europe and a large number of NGOs. And what we hope to deliver in Romania is that we're able to show that to ministers, to directors, to other key policymakers, that there is a strong consensus, a strong solidarity of thinking across intergovernmental organizations and NGOs, which will make them sit up. We've done this before. There was a Helsinki conference on mental health about 5 years ago. And the reason that made an impact, somewhat to my surprise, ministers did go back, change their strategies, because they were aware that was a strong voice, a strong unified voice out there, which came up with strong arguments why mental health care had to change. And we hope that some of the same energy and initiative can be achieved in Bucharest. And these are the outputs, these are the papers we will deliver at this conference. First of all, a declaration, key declaration, and I'll say more about it in a moment. An action plan linked to the declaration, showing the evidence-based interventions. We're struggling there, but it's still a list of expert-based examples of good care. A background paper and expert papers which give the context, the knowledge of the individual areas. So let me say a few words about the declaration, because we have found over the last year that there is a tremendous confusion about what the declaration actually means. The declaration is not a convention. It's not legally binding, and it's not that countries have to ratify it in Parliament. The declaration is a statement of vision and intent, which identifies the responsibilities of member states, the WHO, and the role of partners such as NGOs, But it's a statement of goodwill and intent which one can put to ministries of health because it has been signed and endorsed by them, but it is not legally binding. So it's a strong statement of vision, of direction, but it's not at the level of conventions. And if it were, it would take years to deliver, and it goes well beyond the remit. Whereas an action plan is a detailed set of actions based on best practice, and which is more of a guide rather than a specifically endorsed statement. Now, let me show you a few of the key paragraphs of the declaration, because these are the ones that have to be signed, and as well as a consequence, be endorsed, we hope, by countries in Bucharest. There's first of all this statement of purpose, and this is the central vision of the declaration and of the WHO position. There's obviously the statement about equal citizenship at the heart of the whole human rights approach to disability, and also that have the same right to health and social care, education, vocational training, protection and support. And probably the key statement is that they should have equal opportunities to live stimulating and fulfilling lives in the community with their families along their peers. So our position is that health should contribute to the inclusion, to the community living, rather than being seen as a state in its own right. Health is contributing to inclusion, to the opportunity to develop a full, independent life as much as possible. And these are the sub-points of the purposes. You can see that it builds on the earlier statement, promoting and supporting good physical, mental health and well-being, eliminating health and other inequalities, and preventing forms of discrimination, neglect and abuse, creating a situation where families can cope through support,